Hello, I'm Dr. Herman, and we're with a great patient. This is little Miss Onyx Smith and her mommy. And they came here from another state here in the U.S. to come in for care for Miss Smith's condition. She had a certain kind of syncope condition. So, and this started right after she was born, right? Right after the C-section procedure.
Mm-hmm.
And so right after the C-section procedure, did you notice when she first came out, was there a lack of cognition right away?
Yeah, she was just very stoic and just would just kind of stare.
And was there discoloration of the skin at that point? Like,
Yeah.
like not getting enough oxygen?
Yeah.
Was she looking bluish or?
Yeah, it's, bluish, grayish, and even like a yellowish, orangish color to her skin.
Mm-hmm. And there was a procedure that was done right away. They did an MRI, but they
Did
had
an
to.
MRI and a rectal biopsy.
So they had to sedate her for that. And then after that procedure, did you notice even a worse condition develop?
Well, that was the first one. You know, she was a newborn, so I didn't really know what to look for then. But after her second MRI at 1.5 years, almost 2 years old, I saw a distinct regression and reaction to it the same night she had a bad syncope episode.
Mm-hmm. And how many syncope episodes did she have in a day?
Well, it was started out with, you know, the one every 3 months or something, and then it progressed into multiple times a day. And then since starting your protocol, it's tapered off to basically nothing.
None.
None.
Zero.
Unless, you know, we do her specific triggers.
And there was only one trigger that was brushing her hair.
Brushing her hair, and then the plane rides, but even this most recent plane ride, she didn't have
This
one.
last plane ride. Coming here, that wasn't.
Didn't have one.
When you first came for your first. Yeah.
The first time she had multiple.
First time she had multiple on the plane ride here and the plane ride home.
And the plane ride
And
home.
this time coming here today, she had none.
None.
Excellent. And her cognition before, was she able to even focus on you or focus on anything, anybody around her, or focus on listening to statements from her before?
She would look at me, but it was a very distant look. It was almost like there was nothing behind her eyes.
And now we do have the video that you said that you had filmed before you started this first protocol.
Mm-hmm.
So we'll be able to show you, we'll be able to match up where she is now compared to what she was.
Sweetie.
And the other, she had the droopy eyelids, so it almost looked like she was falling asleep.
Mm-hmm.
Yeah. And was she able to follow any tasks if you directed her to do something like go into her room and get something and bring it back? Did she follow any direction from you?
No, she showed nothing no signs that she understood what you were saying to her.
And so right
She
after
would just
this,
kind of stare at you.
and right after this protocol now, she's able to follow.
Multiple task directions. I know, honey. We're going to go eat in a minute, okay?
She's able to follow multiple tasks. She can follow. She remembers things now.
Her memory is vastly improved.
And even forming some words now compared to before.
Yeah, forming a lot of words are really clear. I know, you want to go eat. I'm
But
sorry.
she's able to form some words now, and she's able to
And
actually.
even like 3-4 word sentences, it's still garbled speech, but you can actually tell what she's saying.
Mm-hmm. So that's
You
starting
know,
to come out now.
I go bye-bye.
She could
Stuff
say
like
those.
that.
And her memory, you actually said, is improving.
Mm-hmm. Vastly improved.
Dramatic.
Yeah, dramatic improvement in memory. You show her a picture in a book and tell her this is an elephant, and then later you go back and pull the same book out and say, what is this? And she'll tell you it's an elephant.
Excellent. Excellent. Very good. And so again, it was multiple times a day. When you said the syncope seizure-like activity, that was multiple times a day. Was it only like, is 2 multiple to you, or is like 3, 4, 5? Is there a way to
Sometimes it would be
quantify?
1, sometimes it would be 4.
And that was every
it was
day of
just
the week?
random, yeah.
Every day of the week?
Every day.
And there was nothing from a medication standpoint or any other things that you tried that was stopping it? I mean, actually a sustained relief?
Nothing.
Nothing. And now you're experiencing that with us.
Mm-hmm.
Excellent. So you're back.
Tapered
Now we
off
have
to-
another exam.
yeah.
Excellent. Thank you. So I will be sharing some findings that I discovered in the first round, if that's okay with you,
Absolutely.
and the findings that we just discovered in the second exam today. And I think one main reason why you're back here for this round is because you're already seeing the improvement. That's been sustained improvement.
I've seen vast improvement
Vast
in
improvement.
every area.
Excellent. Would you recommend this to another parent who's dealing with syncope or seizure-like activity with their child?
Absolutely.
It's working.
POTS, Lyme disease, autism, ADHD. And
It's
the list goes
working.
on and on.
Now we have a very active young girl who just wants to be known
So-
and be heard.
Mwah.
Yeah.
Thank you.
Okay,
your
so
turn.
hopefully after this round, when we can see more improvement, that we can actually get her back on camera. Maybe she'll be speaking some full sentences then,
Yeah,
that we
that'd
can
be
all
amazing.
understand. Excellent.
And
Okay.
hopefully we can, get her brain working well enough and her nervous system working well enough that she might be able to start standing and walking even.
Oh, well, that'll happen, definitely. Right
That-
now,
that'll
what
be
you told
the-
me is that she's having a bit better balance, because she used to sit up and then she'd fall over to the side, but that's not happening anymore.
That's not happening
So
anymore.
we're already seeing progress
I mean,
in that direction.
occasionally, but nothing like it. It used to be every 5 minutes she would boom hit the floor,
Just fall
boom
over.
hit the floor.
But now that's not happening. So we can already see,
Sorry.
we can already see improvement in her nervous system to be able to do that. To be able to
Exactly.
keep some balance even in a sitting up position is great. But we're going to see in this round even more improvement because we found a sedative chemical. We found a sedative chemical that's in the brain, in different parts of the brain. So when we get that out of there, in the kidneys, in the intestines, when we get that out of her, which is the main cause of this right now, when we get that out of her, there's only one thing that can happen, is the body getting stronger, the nervous system working better.
Yeah.
Yeah. Okay.
I know, honey,
All
just
right.
a minute.
Well, you're going to go eat now. All right. Well, thank you for helping me make this video. And then we'll look for the other video from you that we could share with people and help other people get well.
Sounds
Okay.
good.
Thank you.